Hello again, everybody. Today is April 28th. Welcome back into the Keep Boone Healthy Information Channel. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce. We are joined again by our panel of local vaccine experts that include Jennifer Greene, Director of Public Health for App Healthcare, Dr. Beverly Womack of Harmony Center for Women through the Appalachian Regional Healthcare System here in Boone, and of course, Dr. Scott St.Clair from Blue Ridge Pediatrics and Adolescent Medicine. We have heard from these voices a time or two throughout this COVID pandemic and the vaccine element to this conversation, and want to get again a better update on how things tend to change from day to day, week to week, and certainly keep you abreast of new items of information and procedures that you might find helpful as you go through this vaccine process. So Jen, let's first start. We've had a lot happen in this arena in the last 10 days or so since we talked last. We've seen one vaccine paused and then let go again. We've seen changes to procedure as to how mass vaccination clinics are working and how those things will be deployed in our area. Where do you want to start with what you'd like to share with the folks about how things are going right now procedurally when it comes to vaccines?
Well, I would just say we are very excited to be moving into the next phase of this effort, which is going to continue for some time ahead. Really, our big focus is going to be scaling down these big mass vaccine sites and doing more smaller clinic opportunities. I think you're going to see vaccine providers really working with lots of community partners to make vaccine easy, accessible, and available in a lot of different ways. And so hopefully, if you've had some time and you're holding out, or maybe it's been harder for you to get some time scheduled, you'll have another opportunity to go ahead and be thinking about getting vaccine. I just want to say, really, I know that everyone is in love with their masks, but it's the way for us to get back to a better sense of normal, is to get more people in our community vaccinated. It is so important. And I hope that, if you have questions, this is a great opportunity with two trusted healthcare professionals to get some good information. But also, it's time for you to, think about, asking your own healthcare provider if you have questions, because truly getting vaccine in our community is what's going to help us have that community immunity that's going to help us get past this COVID response all the time that I know we're ready to move on from.
Jen, I know that a lot of our community conversation here in the last couple of months has been centered around vaccines and vaccine deployment. Can you give us a little overview, though, of how COVID continues to manifest itself here in the county in terms of numbers or different things that you've seen and things that people may need to be aware of?
Well, I think it's important to know COVID has not left us. We've just seen different population groups affected, particularly younger folks. And we've seen healthy adults in the hospital still with COVID. And I think it's very important to recognize that we're not out of the woods yet. We do continue to report COVID cases every week on our situation report. You can find that at apphealthcare.com. We include clusters and outbreaks in that report, so you can see where we have lots of activity that is happening. I certainly think, we're very hopeful. We've seen things go down, but recently, we've seen a little uptick. So it's important to know that, we haven't seen the steady decline that we would hope for with cases. And I think the way that we get past that is to get more people vaccinated.
Dr. Womack, last time we had you on with us, we talked about some new information and updated information as it regards to women's health and vaccine. And there was a lot certainly talked about early on in the process with that. There continues to be not only a lot of conversation, but updates to the guidance as it relates to women's health and whether or not one should get vaccinated. What can you tell us about updates and any new information that you think would be helpful for those that are making the decision to be able to consider at this point?
I'm super excited. The end of last week, so this is really new data and changes in our recommendations. We had a publication in the New England Journal of Medicine that followed women who had joined a registry who had become vaccinated while they were pregnant, and they followed nearly 4,000 women, and those 4,000 women had no adverse outcomes throughout pregnancy and with delivery, which was fantastic information. That publication allowed the CDC to change their recommendations from you should consider getting the vaccine to every pregnant person should be offered the vaccine. So there were no safety issues that arose out of that study. It's very, very promising. And now all of our organizations, the group that takes care of infertility patients or patients trying to get pregnant, are saying you should consider the vaccine or offer the vaccine to those patients. High-risk pregnant patients, there's really nobody that I take care of that wouldn't be a candidate to get the vaccine. And that is just such super data to have, because what we're seeing around the country now is more pregnant ladies getting COVID and more pregnant ladies needing to be admitted for COVID. And unfortunately, more complications that we did not see when we were doing a little more strict job with quarantining and we were all stuck at home. So concerning for our pregnant ladies, and if they're not vaccinated themselves, or particularly if they're in a home with other kids that haven't been vaccinated because they're not able to yet. So I'd say if you're pregnant, if you're thinking about pregnancy, if you just had a baby, even if you're breastfeeding, all of those women would be a great opportunity to be vaccinated. Speak with your healthcare providers. There may be some situations where we want you to wait, or it may be a time we want to identify when would be the best time, but for almost all of us now, we say vaccinate.
You know, I know that a lot of the early conversation centered around women's health and vaccines was all directed toward fertility related issues. Are there other things that you're hearing from patients or that you're seeing move around through the various medical journals that are pointing toward common questions that may not necessarily deal with fertility related issues, but other things that women may be considering when it comes to their own personal health?
Well, we do know the American Society for Reproductive Medicine has come out and said that there's no evidence that the COVID vaccination can affect our fertility or cause problems in that arena. We know our DNA is not altered by the vaccine. Those questions we hear quite often, especially as we're starting to think about vaccinating our adolescent population. Already, if you're 16, you can get a vaccine. I wish my child's birthday was before December because I would have him in line to get his shot. I cannot wait. But there's just the data that continues to roll out. We now have 75% of our seniors in this country vaccinated. Nearly half of our adults have gotten one shot, and we just are not seeing complications. So there's just nothing to suggest that anybody should hold back.
Dr. St.Clair, I know you and Dr. Womack both see some similar crossover in age range, and certainly you both see the very new patients, our newest high country residents, perhaps sometimes before anybody else does. So with all of that said, there's been, again, more conversation about moving the vaccine age range and seeing another portion of our adolescent population become eligible for vaccine. Can you give us any status updates on that you have heard through your channels? And kind of the same question that I asked Dr. Womack, common questions that you're getting in your practice right now that you feel might be helpful to address.
Yeah, that's great, David. I think first thing to know is just that the vaccine's available now for 16 and older. So there's nobody ahead of you in line. If you were figuring you were waiting and afraid you're going to take a dose from somebody, it's wide open for anyone 16 and older. If you're 16 and 17, you need to get the Pfizer vaccine because that's the only one approved for 16 to 17. But if you're 16 and older, we just could not recommend strongly enough to go ahead and get the vaccine and to go ahead and get it now so that the clock starts ticking to get you fully immunized, to keep you safe, keep others around you safe. I think one thing on the 12 to 15, the 12 to 15 year olds with Pfizer, that data was submitted to the FDA almost 3 weeks ago. So we're sort of expecting any day now to sort of get a status update with that. But I would think relatively shortly, that's going to be a potential option for 12 to 15. So that's going to be something the FDA is going to make some announcements on soon. So I think people in that 12 to 15, stay tuned. We'll keep you up to date when that comes through. But Dr. Womack hit on this. I think if people haven't been following some of this closely, I do think it's important to note that the variants that people may have been hearing about throughout the country, just basically that variant means that the virus has changed a little bit. And as these viruses have changed, they've become more transmissible, and that meaning they're more infectious, but they've also caused more severe disease, and they've caused more severe disease in young people. And so when you look up at Michigan, if people haven't been following, and Michigan's had a huge outbreak, and they actually had way more hospitalizations right now than they did during their winter peak. But in raw numbers, young people took up a way higher numbers than they were before in terms of being hospitalized. So these variants are more contagious, they're more severe, and they seem to be affecting young people more than they were before. So that's just a reminder to say these variants are floating out there, and to the extent that we can keep cases down, we're going to have less variants, and it looks like the viruses protect really well against the variants. So I think that's really important to know. I did want to just echo what Dr. Womack said, that is a question we get commonly in the office, is as people hear about the mRNA vaccines, the Pfizer and Moderna, we get questions about, does this affect and alter people's DNA? And I just think people need to hear loud and clear, it does not affect anyone's DNA. The mRNA never goes into the nucleus of the cell to get real scientific where the DNA is. It doesn't even get near there. So the mRNA does not have anything to do with your genetics, your genetic code. And so that question's come up to me a lot, and I want to make sure people are really clear on that in case that's a hesitation for them about getting vaccinated.
Again, one quick last follow-up for the two docs here. As we know that the state of North Carolina is in the process of kind of eliminating restrictions, and we've seen that June 1st date thrown out there by Governor Cooper as a time where maybe most of the restrictions in the state, sans the mask mandate, could be lifted or making progress to that point. So with that said, a lot more community activity, the reemergence of camps, the need for after school care for children, those types of things will begin to ramp up. Any suggestions that you all might have in terms of understanding that there's risk in everything we do? We certainly understand that, but in this vaccinated, protected world of COVID, things that we should still be considering as not only community citizens, but parents with kids and that kind of thing, as we are beginning to open up new opportunities for exposure again.
I certainly would offer, if we're talking about June the 1st, if you got your vaccine this week, you would be fully immunized by the time things open up, which means you would be able to be outside without a mask on, and you'd be able to go to restaurants, you'd be able to go to other people's homes. So that would be number one. And I still am a huge advocate of hand washing and staying home if you're sick. Even if you think you might be sick, testing is readily available. So if you're concerned you had COVID, it'd be important to know, even if you don't feel super bad, but just so you could protect others around you. So, but the best thing is if you haven't gotten vaccinated, get vaccinated now, and then you'll be covered.
Yeah, I guess could not emphasize that enough, is that there is something out there that helps keep you safe in ways we did not have last summer, and that's the vaccine. So go get vaccinated. And, in general, the spread among kids has been fairly low. And most of the time when kids have gotten COVID, it's been because of an adult in their life, whether that's someone in their home or some other contact they've had. And so to the extent that we can help protect all the adults in our community, the chance your kid gets it goes way down. And I think the other thing is we're moving into a time of year where it's just a phenomenal place to be outside. And that is one thing that we had learned for sure, is that outside is a really safe place to be. So get outside, spend as much time outdoors, interact with people outdoors, and know that that's going to be a good and safer environment than being inside. And, I think echoing what Jen said earlier is everybody has the desire to get back to normal. It only happens when people get vaccinated. So please, 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 if that's been something you've been thinking about, not sure about, now's the time to get it done.
But Jen, kind of wrap this with you, and we're as we record this right now, about an hour away from hearing about new executive orders and things along those lines that we will certainly see guide us throughout the course of the rest of the month of May. Aside from what we've talked about today, any other things operationally that you feel like it would be good to share with either the business owners that are trying to, if they can get staffed, open up maybe their businesses a little bit more than they have been? Any things like that you'd like to share with community members and specific guidance around some of those situations that maybe we'll be seeing for the first time in a while?
I would just say be an advocate and a role model. Talk about vaccine, talk about where folks can get it, and do reach out to us if you want to partner with us on how we can promote vaccine together. We are going to be doing a lot of effort to reach out to our community to do that in a lot of different ways. But otherwise, I would just say be vigilant. I know we're done, we're over this. But, besides being outdoors or being with other people that are vaccinated, when you're in a crowded space or you're in an indoor space, it's still important to wear a mask. And tell your friends, tell your loved ones about why you got a vaccine, and help them find helpful resources to answer their questions. Because, oftentimes it may be your voice that helps make the difference in someone making a decision to get vaccinated that will help us all.
Well, we certainly appreciate the three of you for always having time to carve out for us to share information. We'll continue as we have before to put links to the practices and to the health department in the email that we send out to chamber members and the Facebook posts that we post on the Keep Boone Healthy page, to make sure that you've got access to good information, whether that's booking vaccine appointments, getting more information about vaccines available here, and anything else that you might have come on the radar, so to speak, as we continue through this conversation. So thanks to you all. I know your time is very valuable, so we'll let you get back to it, but appreciate you sharing with us once again.
Thank you, David.
Have a good day.